A series of dihydrogen substituted in second position by basic side chains and is felt and their potencies are calcium antagonist. Amlodipine bears the basic 2-amino ethoxy methyl group on the DHT rule, strongly influences the ionization and lipophilic profile of the drug. The ortho substitution being the best one in terms of potency and selectivity. In this aromatic substitution, further substitution or ortho substitution is more effective than meta and para. The electron withdrawing groups are more favored than electron releasing groups. And crystallographic analysis demonstrates that DHP ring of amlodipine is considerably more planar. And it shows that primary amine amlodipine is much more stable metabolically than the corresponding secondary or tertiary analogs respectively. And finally, it is considered that amlodipine is the second generation analog nifedipine has fulfilled concept optimization of the prototype medicinal chemistry. It possesses improved physiochemical properties both like lipophilic and antioxidant together with excellent pharmacologic profile including selectivity, potency and long duration of action. This achievement has been completely confirmed in the clinical setting in which the improved profile is translated into long-lasting and effective anti-hypertensive agent in combination with a significant anti-atherosclerotic action that is beneficial for patients. And finally, references this included different sites, general articles, research papers, and some books, and important sites like PubMed and Web of Knowledge. Thank you very much.
Hello everybody. Today I am going to give a presentation about drug discovery technology, and my drug is cetirizine. The brand name is Dietec. Let's start with a short introduction. Cetirizine hydrochloride is the active component of Dietec. Dietec is the brand name given to the cetirizine, and Pfizer is synthesizing this drug. This drug is available in the form of tablet and syrup. The highly active, orally active forms of the drug. This drug belongs to the class of selective H1 receptor antagonist. The mechanism of action of drug is cetirizine is a human metabolite of hydroxyzine. Is the antihistamine. Its principal effects are mediated by selective inhibition of peripheral H1 receptors. The antihistaminic activity of cetirizine has been clearly documented in a variety of animals and human models. In vivo and ex vivo animal models have shown negligible anticholinergic activity. In the clinical studies, however, dry mouth was the common with cetirizine than any other of the drugs. In vitro receptors binding studies have shown no measurable activity for the other than H1 receptors. Indications of this is mainly useful in the seasonal allergic rhinitis. The symptoms treated effectively are sneezing, nasal pruritus, ocular pruritus, tearing and redness of the eyes, and the same with the perennial allergic rhinitis. Symptoms treated effectively are sneezing, postnasal discharge, ocular pruritus, and tearing. Target identification. What is the target of this cetirizine? If it is H1 receptor, how it is H1 receptor? We will see that this is mechanism for allergic reactions are caused by the release of histamine in the body. We will see how histamine is released in the body. first it is coming in contact with the beta cells which are present in the bone marrow. Then they are coming in contact with the plasma cells which are present, which are the WBCs actually, present everywhere in the body, and antibodies, IgE antibodies which are present on previously beta cells are coming to the plasma cells, and then antibodies are released and that goes to the mast cells. Then while attaching to the mast cells, the polars are attracted towards the IgE antibody, and in the section 4 you can see subsequent contact with the allergens. When these allergens come in contact with the antibodies, the mediator histamine and other chemicals are released from the body. That's why our thyroid, when this histamine is binds with the H1 receptor, allergic reactions occur. So our main target is H1 receptor. Target validation. The validation of the drug involves the demonstrating the relevance of the target in the disease process. In the disease process, we identified the target is H1 receptor. Histamine is released from the body causing the allergic reactions. When it is bind to the H1 receptor, which are present on the smooth muscle cells, on vascular endothelial cells, and in the CNS, central nervous system. You will see how the histamine mediates the allergic symptoms by binding to the receptor of histamine on the cell. This is the structure of histamine, and like H1 receptor, the histamine is binding to the H1 receptor. You can see here the H1 receptor binding of histamine to the H1 receptor. When histamine is released from the body, then it attaches to the binds to the H1 receptor present on the smooth muscles and intravenous organs. Antihistamine block the partial action of the binding of histamine to the H1 receptors. You can see here in the figure. Lead generation. Classes of first generation antihistamine: ethylenediamines, ethanolamines, alkylamines, piperazines, and prazosin. Citrazine belongs to the class of piperazine. The synthesis of citrazine, the reaction scheme for the synthesis of citrazine. Grignard addition to the p-chlorobenzaldehyde gives the 4-chlorophenyl. This is then which dominated to the 4-chlorodiphenyl methyl bromide. SN2 displacement of the bromide carried out in the presence of Na2CO3 in refluxing xylene. Hydrolysis using KOH in ETOH afforded piperazine. In addition to the SN2 displacement of the 2-chloroethanol by piperazine gives alcohol, which was subsequently coupled with sodium chloroacetate, followed by this HCl salt deformation and ring crystallization with 2-butanol to deliver citrazine. Some common structural features of classical first generation antihistamines. This is the common structural features about the basic ring. The two aromatic rings connected to the central carbon, nitrogen, and oxygen. The space between central atom and the amine usually 2 to 3 carbon in length. Can be linear, ring, branch, saturated, or unsaturated. The amine is substituted with small alkyl groups. Chirality at the X and having the ring in the different planes increasing potency of the drug. Okay, thanks for the overview.